disease. When I think about mitral valve disease, I don't think about whippets. I think about little one-handed dogs, dogs you can put on the table or put in a purse. This was my little one-handed dog, Primo, celebrating his quinceañera. Yeah, I got him a piñata for the occasion. He had mitral valve disease. He had bad mitral valve disease, but he didn't get it until he was 12 years old, right? And that's what we want. When we think about mitral valve disease, we want a disease that's coming on in the late stages of life. If you're seeing dogs that have this disease at 4 and 5 years of age, that's too early, right? Those are the dogs that are going to pass on that lesion into their offspring and pass down that early onset form of the disease. That's what we want to avoid. But what is mitral valve disease? What's going on in the valve itself? So there's a lot going on beneath the surface of the mitral valve disease. The mitral valve should be these paper-thin structures within your heart that allow blood to move from chamber to chamber on the left side of the heart. Those valve leaflets do a lot of work, and when they become diseased, it's a big problem. Well, what's happening when they become diseased? This leaflet of the mitral valve is expanding, and it's being filled up with a gooey-like material. Glycosaminoglycans and proteoglycans are living in that space, and it looks like a pillowcase. It starts to fill up. And when it starts to fill up with that goo, the edges of the valve leaflet start to retract away from the center, where they're normally keeping blood from leaking, right? But if they get pillowy and the edges start retracting back, that's when we actually see leaking of blood flow across that valve. And that is kind of the fundamental process of mitral valve degeneration, or myxomatous mitral valve degeneration, or mitral valve disease, or mitral valve endocardiosis. We have a lot of names that we use for this disease, but it's a really important problem when the valve leaflets start to fill up with that goo. So it expands a specific layer of the valve, they thicken, they roll back. It can actually go down and affect what we call the chordae tendineae. That's the support structure of the valve that keeps it in place. The valve will start to prolapse. When you get your echocardiographic screening for breeding dogs, you'll see Dr. Steppen and Callahan looking closely to see if that valve is buckling back or prolapsing. That's part of this disease process. That generally happens right before the valve starts to leak. And then if it gets bad enough, it can even rupture or break these cords, and then we end up with a massive leak. And so this valve should be paper thin and see-through, should look like this part over here. But when it gets diseased, it starts to get thickened and filled up. It starts to roll at the edges, and eventually it gets so opaque you can't see through it, and the chordae, those support structures, start to break. It's a really, really nasty disease. And it has a genetic basis. It affects certain breeds of dog more often than others, right? This is a Cavalier King Charles Spaniel. This is the poster child for mitral valve degeneration. They're lovely dogs. I love this picture because I call this dog a Pimobendan pirate. So for those of you that have had dogs with mitral valve disease, Pimobendan is the mainstay of therapy, and Cavaliers should be born with a prescription for Pimobendan in my mind. They all deserve it at some point. They love it, and it works really well. Whippets, however, are really interesting. They're not small dogs. Some of them behave a little bit like small dogs, but they're not small dogs, but they get this typically small dog disease at a really high incidence, right? They get a lot of mitral valve disease. So does the dachshund. Any coat, dachshunds, any coat, all coats? All coats of dachshunds, yeah. So Dr. Steppen alluded to the work that we did in 2015 looking at mitral valve degeneration in whippets. We did some of the first pass genetic studies of this disease in the breed, where I came out, I can't remember where that original show was that I started collecting with you and Heidi, but it was somewhere. I think it was East Coast at a Red Roof Inn, maybe. Um, does that sound reasonable? Yeah. Oh, maybe Denver. Who knows? But we started collecting whippets, and we started looking at severity of the disease based on age of onset. So we said, if you get this disease early, it's worse than if you get it late. And so we binned the dogs as dogs with early onset mitral valve disease being more severe, dogs with late onset mitral valve disease being less severe. And we said, is this genetically important? Is this a heritable condition? And we used something known as a genome-wide association study, which at the time looked at about 180,000 different pieces of genetic information in each of the dogs that we studied. Each of the dots on this screen is one piece of that information, and each row here is actually, I guess those are columns. Each column here is a chromosome in the dog's genome. And this is called a Manhattan plot. It's supposed to look like a New York City skyline. And so when you see a skyscraper, it tells you that the disease of interest is inherited in that location in the genome. And so what you can see here is that chromosome 2 and chromosome 15 have really important genetic markers for mitral valve disease severity in whippets, right? We'd never seen this before. And chromosome 15 looks really interesting because it has this nice streak that goes all the way up and crosses this red line to reach statistical significance. So we're able to conclude from this that severity of mitral valve disease in whippets is heritable, and that whatever we're inheriting that causes that more severe disease phenotype, or what we're seeing that's more severe, is living somewhere, at least in part, on chromosome 15. So this is our roadmap. But chromosome 15 is big. It has millions and millions and millions and millions and millions of base pairs and thousands of genes that live in that one space. So this is kind of the needle in a haystack, right? We proved that it's inherited. We proved where it lives, or where we think it lives, but we haven't yet shown what it is. And people have been working on mitral valve disease and its genetics for quite some time across many different breeds. Nobody else is yet doing whippet genetics in mitral valve disease, but some folks have successfully done some work in other breeds, including the Cavalier King Charles Spaniel. So taking a different approach, this is a really interesting thing. There's a gene called nebulette. Nebulette has a number of different genetic mutations in it that, when we look at it critically, is associated with mitral valve disease in Cavalier King Charles Spaniels. It, in fact, has 100% linkage with this disease process, meaning basically every Cavalier you find that has mitral valve disease, you can link back to one of these variants in nebulette. The problem with nebulette is that it's really, really, really common. 97.7% of Cavalier King Charles Spaniels have this genetic variant. So breeding away from it is not just challenging, it's a terrible idea unless you no longer want to have a Cavalier, right? You would totally have to outcross in order to maintain a breed population that had any genetic diversity, right? So we're talking about bringing in something that looks like a Cavalier and breeding it to a Cavalier, but it really isn't a Cavalier if we're going to do it right. So the nebulette story is fascinating because it tells us a little bit about what might be causing mitral valve degeneration in another breed of dog, but it hasn't helped the Cavalier King Charles Spaniel because the Cavalier is the wrong breed to do the genetic studies of mitral valve disease in, because so many of them have this disease. That's why I think we're making the right decision by looking at whippets, who we can clearly delineate a severe disease phenotype and a less severe disease phenotype, right? Dogs that get it very late versus dogs that get it very early. That's very easily done in the Whippet. It is not very easily done in the Cavalier King Charles Spaniel. And so while you can test for nebulette, people don't really do that right now because all of the cavies are positive for it. Now, there's been some work to see if nebulette loci actually matter in other breeds of dogs, and some dachshunds have the nebulette locus. Whippets don't. So it's not the story in Whippets, but it's an interesting story nonetheless, because many, many, many genes in the dog genome share common pathways. And so now that we know a little bit about nebulette and how it can be a part of this kind of infrastructure of the valve, we might be able to look at what we find on chromosome 15 for other genes that are somewhat related to nebulette. So that's kind of one of our focus. So let's shift gears for a minute and talk about heart murmurs and mitral valve disease. So what actually causes the heart murmur? Heart murmurs are really fun. This is physics, and we're just assaulting the dogs in a quiet room, listening for a heart murmur. We know that heart murmurs can tell us a lot about mitral valve disease in the average dog. What about in Whippets? Yeah, how many people in the room have Whippets with heart murmurs? Yeah, all of you. That's right. Or mostly all of you, yes. Because Whippets have heart murmurs, right? They are athletic sight hounds, and they get heart murmurs for a very specific reason. But they can also get heart murmurs for mitral valve disease. And so the key components that tell us when a heart murmur comes up is how fast the blood moves, velocity, how thick the blood is, viscosity, and how big the vessel is that it's entering, vessel diameter. Those things go into this equation known as the equation for Reynolds number. And as your Reynolds number exceeds 4,000, it gets a little wild and starts to make noise. And guess what? Whippets have a high velocity of blood flow relative to other breeds. And their kind of transition to vessel diameter based on how they're built is a little different as well. And so they're made to have that kind of athletic sight hound heart murmur that you've all become so accustomed to knowing about. And Dr. Steppen and colleagues, Dr. Callahan, have told us a lot about Whippets and murmurs over the course of their studies at the National for many years. And so in this study of 200 dogs, they told us how many of those 200 dogs had any heart murmur. 92.5%. So lots of heart murmurs in Whippets. But most of those heart murmurs live at the left base where this athletic sighthound type murmur lives. But there are some dogs that have the murmur of mitral valve regurgitation and mitral valve disease, right? And separating that out can be really challenging on auscultation alone. And that's why you're all rightfully so screening appropriately by the combination of auscultation and echo. I said that the flow velocity was higher in Whippets. On another of Dr. Steppen's studies, they reported the reference range to go all the way up to 2.29 meters per second for aortic flow velocity. And that would be a failing aortic flow velocity in many dog breeds, right? A bull mastiff with an aortic flow velocity of 2.29 meters per second is in my study of subaortic stenosis for bull mastiffs. So it's very different by breed. And the type of heart murmur matters, right? So we talked a little bit about this just a moment ago. Whether it's at the base or whether it's a mitral valve regurgitant type murmur matters, but they can happen together. And in fact, they do happen together enough that it's not as cut and dry as just having a quick listen and saying, well, that one's mitral valve disease and that one's an athletic murmur. They can kind of overshadow each other over time. So in that study, they show us mitral valve regurgitation versus no evidence of mitral valve regurgitation by age. And what you can see is that the dogs that had mitral valve regurgitation largely have their kind of median over 8 years of age. So that's average. So if you're getting your dog screened by echo and you're not finding MR until 8 years of age, you're doing good, right? You're better than average there. The dogs we're talking about in our genetic study, the thing we want to limit and find a way to reduce in the population, are the dogs that live down here, right? This is the interquartile range, little hairs here. This area contains kind of 25% of the dogs with mitral valve disease. And we want to get rid of that tail. We don't want to see mitral valve disease cropping up at 2 years of age to 6 years of age in whippets. And in fact, that's what we're doing when we're looking at the genetics, is prioritizing those dogs as having the most severe disease kind of phenotype, that early onset.
Now, the last time you guys did your presentation, I feel like you said the average age was 7. So does that mean we've actually increased a year on what our average age for regurg is?
I think that it is a difference in data.
Yeah, well, that's median.
Yeah.
So 50% of the dogs, and if you look at the chart on the right, where the stats come out, is that at somewhere between 7 and 8 years old, 50% of them will have microregurgitation. Okay. But it's between the 2 years. So we have been saying 7, but it's somewhere between 7 and 8. Okay.
Just a funny quirk of statistics.
Yes.
On the right side of this slide, though, what you can see is kind of numbers of dogs or percent of dogs that have mitral valve regurgitation by age group. And you can kind of see how this goes up in this nice linear fashion. And so we see a higher percent of echo at a higher age group. These are the dogs that we're not worried about. These are the dogs that we are worried about. So when you get an echocardiogram and we're talking about mitral valve disease, this is what it looks like. So this is that right peristernal. So the dog's lying on its right side. We're looking at the 4 chambers of the heart. The mitral valve is this moving piece right here in the center. And this party-like spray of color is the mitral valve regurgitation, that leaking of blood across the valve that's no longer competent. And when that gets bad enough, the valve gets thicker and thicker, the regurgitation or leaking gets worse and worse, this chamber starts to enlarge. And the left ventricle starts to enlarge. And if they enlarge enough, the outcome becomes congestive heart failure. And that's what we want to prevent. So this is a dog with quite severe mitral valve regurgitation. We see that this color in that holding chamber, the left atrium, is taking up more than 70% or so of the space. So that's pretty significant or severe mitral valve regurgitation. But these dogs continue to squeeze pretty well. In general, mitral valve disease dogs do a good job of maintaining cardiac output. They squeeze really well, so we see their heart muscle come together pretty well in the middle there. Has anyone had a whippet diagnosed with dilated cardiomyopathy? And has anybody had that diagnosis reversed by somebody who sees more whippets? Yes? So whippets do get dilated cardiomyopathy, not at a high incident or rate, but whippets also have their own special reference range for heart size, particularly when they're athletic and well-trained. And so we're going to talk about that for a minute. But I just wanted to show you the difference here. This is a dog with dilated cardiomyopathy. So on that last view that I showed you, you saw the ventricle, the heart muscle squeezing really well. In dilated cardiomyopathy, the heart muscle doesn't squeeze very well at all. And in that last view, you saw lots of color, while with dilated cardiomyopathy, you just see that little tiny squeak of mitral valve regurgitation. So very different diseases. Both can certainly happen in the breed, but really important to know that dilated cardiomyopathy, while we want to make sure we're catching it if it's there, isn't as big of a problem. I bring this up because I do think it's important to recognize that you need to be seeing somebody who's reading the literature when they're doing your breed screenings, right? You're all very fortunate to have Dr. Stepan and Dr. Callahan coming out and doing breed screenings for you, because whippets, particularly whippets that are well trained and do work, have bigger hearts. And if you didn't know those cutoff points, you might confuse that for early dilated cardiomyopathy. And so look at these conditioned versus unconditioned whippets in terms of the size of their ventricle, bigger. Size of their ventricle when it squeezes, bigger. Overall mass of the left ventricle, bigger. All because of their athleticism. So these are real athletes, and it makes a real difference in what we measure and how we assess their hearts. So keep that in mind. If you get a diagnosis of equivocal dilated cardiomyopathy and you're not sure about that, talk to somebody that you know is deeply invested in the breed, that does a lot of whippet echo clinics. Really, really important. So environment plays a role with exercise. Environment also plays a role with diet. So for those of you that remember the FDA warnings about grain-free diets, high degrees of peas and legumes resulting in dilated cardiomyopathy across a number of breeds, whippets were not excluded from that information. And so in this study, looking at cardiac biomarkers and echo, it's important to recognize that cardiac troponin, a marker of myocardial damage, was higher in the dogs that were eating diets that had a high degree of peas and lentils in them. And that was in whippets and a few other breeds. So just important to keep in mind. So if you get a diagnosis back of dilated cardiomyopathy or equivocal dilated cardiomyopathy, I would be asking myself about the dog's environment. Is this an athlete or a couch potato? And what is it eating? Really, really important questions. This has been published time and time again. I know there are people that believe so strongly about their pea-laden diet that they'll lay down their lives for it. I don't care what you feed, but I'm telling you, if your dog has DCM, stop feeding the one with peas and
I
lentils.
was just gonna ask, if it's a diet-induced condition, can it be reversed?
It can, yes. That's the brilliant part about it, is almost all the dogs in the study by the FDA, when they switched food, went back to normal or very close to normal. And so it makes a huge difference. Yeah. I'm so happy to not be involved in that research anymore. I'll just throw that out there. So, back to mitral valve disease. Mitral valve disease is one of the few diseases in cardiology that's easy to know how severe it is based on the heart murmur. So while that early stage of disease can be confusing because of whippet athletic murmurs or a little squeak of mitral valve regurgitation, with advanced disease, it's not that hard. With advanced disease, by the time we get into loud or very loud heart murmurs, the disease is much, much more severe. So as we're listening to dogs and having your dogs examined, if your veterinarian is taken back by the grade of the heart murmur when they listen to your whippet, that probably represents significant disease. Soft murmur